Okay, Gavin, let's now talk about leg length discrepancy in childhood. Um, you have a 2-year-old with unequal leg lengths and parents are really worried. How would you deal with this situation?
Yeah, so at 2 years old, let's say you've ruled out some other important causes like a hip dislocation. This is a genuine length discrepancy. But at 2 years old, you're probably not going to be actually treating it. You're going to be managing the parents' expectations, and they are extremely worried about this. So what you mustn't do is say, well, I just don't know. Let's just wait and see what's actually going to happen. That's not going to help anybody. What you must do is try and make a prediction, not about what the leg discrepancy is now. You can see that. You want to know what it's going to be if there's no treatment. And why that's so important is because depending on what that discrepancy will be if you did nothing, that will allow you to decide what is the right treatment for the parent. So you can tell them now, with this 2-year-old, this is going to be my plan over the next 10, 12 years. That's really important. How do you do that? Well, you need to know a couple of things. You need to know diagnosis. You certainly need to know if this is congenital or acquired. And then there are a number of ways, quite simple ways actually, nowadays, of trying to predict what that discrepancy will be in the future. In fact, of course, nowadays it's all done on an app. And again, it's something we'll probably talk about on the course. But that piece of information is so important because it allows you to have a plan and it allows you to explain to the parents that there's a plan, and suddenly the situation is defused.